the shoulder complex. Okay, suppose shoulder complex, if we take, the shoulder complex is going to form because of the bones scapula bone and clavicle bone and sternum. Okay, sternum no need, scapula, clavicle and humerus. So these are the key structures. Okay, because of these bones we are going to get the shoulder complex. Okay, shoulder complex. Now if we see scapula, clavicle, humerus, suppose here I'm drawing, this is our scapula, imagine this is our scapula. So here we will be having clavicle anteriorly, we are seeing the scapula anteriorly, so here we will be having clavicle, and then here we will be having the humerus, here we will be having the humerus. So that scapula, clavicle, humerus are going to make the shoulder complex. Here shoulder complex, what is the meaning of complex means the shoulder complex is going to made by the scapulothoracic joint, sternoclavicular joint, acromioclavicular joint, GH joint, glenohumeral joint. Okay, first one scapulothoracic joint. So the joint is going to be between the scapula and thorax. Scapula and thorax. Here SC joint, sternoclavicular joint. Sternum. Here the joint will be between sternum and clavicle. Sternum and clavicle. AC joint. Here AC joint is going to form between the acromion plus clavicle, and here if you see glenohumeral, it is going to form between the scapula plus humerus. So these are the bones will involve scapula and then sternum and then humerus. So these are the bones will involve here, and clavicle also. Now we'll see we have shoulder complex. Here one confusion is there. What is shoulder joint? What is shoulder complex? What is shoulder complex? Okay, what is shoulder complex means shoulder complex is the combination of the scapulothoracic joint, sternoclavicular joint, acromioclavicular joint and glenohumeral joint. Shoulder joint is nothing but it is only glenohumeral joint. So shoulder joint is means glenohumeral joint. Shoulder complex means combination of the all the joints, combination of the all these four joints will tell shoulder complex. Next point, components of the shoulder complex. Components of shoulder complex. Here components, if we see, here we will be having two type of joint. First one functional joint. Okay, functional joint, and second one anatomical joint. Otherwise we can say like anatomical joints are true joints and functional means it's a not true, false. Okay, simply like understanding false joint. Okay, so if you see anatomical joints, here we will be having sternoclavicular joint and acromioclavicular joint and glenohumeral joint. Okay, these three are the anatomical joints. Functional joints, here scapulothoracic joint. What is the point means here if we see all these joints, here sternum is going to operate with the clavicle, acromion is going to operate with the clavicle, inner cavity of the scapula is going to operate with the humerus. But here if we see in this functional joint, the scapula is not going to articulate with the thorax. It is just positioned on the otherwise it is just placed on the thorax. So that's why this joint is the functional joint. Remaining three joints are the anatomical joints of the shoulder complex. Till now is four joints. So four joints here. One is a functional joint and three are the anatomical joints in the shoulder complex. One more joint is there. The joint it is going to form because of the coracoacromial arch. Suppose if you see the scapula laterally, this is the glenoid cavity. So we are seeing this is the glenoid cavity of the scapula. So if you see here we'll be getting coracoid process of the scapula. Here we'll be getting acromion process. This is anterior, this is posterior. We are seeing scapula laterally. So what is this coracoacromial arch? The ligament which is present between the coracoid. This is coracoid process. This is acromion process. So from coracoid to the acromion process we'll be having one ligament. This ligament is nothing but the coracoacromial. This ligament is coracoacromial ligament. So it is going to make an arch here. So that here head of the humerus will articulate here. So the joint is going to present between the coracoacromial ligament, at the same time head of the humerus. This is the fifth joint. And one more name for this coracoacromial arch. One more say like suprahumeral joint. Why? Because here head of the humerus will be here. So the joint which is superior to the humerus. So that's why suprahumeral joint. So this is the fifth joint. It is also a functional joint. What it means? Functional means the head of the humerus just will be placed here. Otherwise coracoacromial arch just will be placed here. But there is no articulation. There is no connection, articulation between these two structures. So that's why this is also a functional joint. So that here total joints will be 5 joints, and here functional joints are 2. What are those two functional joints? Scapulothoracic joint and coracoacromial joint, otherwise suprahumeral joint, and remaining 3 anatomical joints. Here 3 anatomical joints: sternoclavicular, acromioclavicular, glenohumeral joint. So this is about the components of the shoulder complex. Now we'll see one special point, that is about the sternoclavicular joint. Sternoclavicular joint. Suppose here this is our clavicle. This is our clavicle. Here we'll be having manubrium of the sternum. Here we'll be having manubrium of the sternum. This is cephalic fossa. So that here we'll get scapula. Here we'll get scapula, and here we'll be having the head of the humerus. And here we'll be having the head of the humerus. Okay, leave it. So that here the joint between head of the humerus of the glenoid cavity, it is nothing but the GH joint, glenohumeral joint. Here clavicle and acromion process of the scapula, it is AC joint, acromioclavicular joint. Here the joint between clavicle to the sternum, it is nothing but the sternoclavicular joint, sternum and clavicle. So if you see a skeleton, human body skeleton, head will be there, neck will be there, and then trunk will be there. The trunk is going to divide into thorax and abdomen by the muscle, diaphragm muscle. So that here we'll be having two upper limbs and then two lower limbs. If we see the skeleton will be having two parts. First one axial skeleton. Second one appendicular skeleton. Axial skeleton is nothing but the, see, the center portion. The center portion is nothing but the axial skeleton. Okay. Appendicular skeleton means both upper limbs and lower limbs. These are the appendicular skeleton. Suppose if we take, this is right side, okay, right side, this is left side. So the right side will be having upper limb and lower limb, left side also upper limb and lower limb. The entire upper limb is going to connect to the axial skeleton by the joint. That joint is sternoclavicular joint. So the entire upper limb, like shoulder joint, elbow joint, wrist joint and hand. So here we'll be having arm, forearm, wrist, hand. Okay, so the entire upper limb is going to connect to the axial skeleton by the single joint, that is the sternoclavicular joint. If we see the movements of shoulder complex, here we'll be having so many movements. Okay, first one, just like example, elevation movement. Suppose if we take the scapula, scapula will be like this. So here spine of the scapula, this is the head of the humerus. We are seeing it posteriorly. Here we'll be having the thoracic spine. Okay, thoracic spine. Posteriorly we are seeing. Suppose, okay, now the patient is in resting position. That means stable position. So when we are in stable position, it will be like this. Suppose if the patient is doing elevation is, so that time here humerus will be like this. It will move. Suppose here head will be there. This is our neck. Okay. So if patient do elevation, this is the elevation activity. Here what is the point means, if the patient is doing, or person if he is doing elevation, the elevation movement requires the movement of the scapulothoracic joint, sternoclavicular joint, acromioclavicular joint, glenohumeral joint, suprahumeral joint. So all these 5 joints will involve together to create one movement, either elevation or depression, mostly elevation. So that here the point is, the movements what are having in the shoulder complex, it is the combinated movements. It is an integrated function of the all these joints, The name for this one is scapulohumeral rhythm, also called as the integrated function of the shoulder complex. Shoulder joint means only glenohumeral joint. Shoulder complex means the combination of all these joints. So that elevation activity, it is the integrate means combination, integrated function of the all these joints. Clear?